my name is Micaiah Pike, and today I'm going to discuss osteoporosis with you guys. What is osteoporosis? Osteoporosis is a bone disorder characterized by the loss of bone mass, increase in bone fragility, and an increased risk of fractures. Essentially, this disease thins and weakens your bones, and it can cause your bones to break really easily. And this photo up in the top shows what a healthy bone looks like and what a bone with osteoporosis looks like. So what causes osteoporosis? Our bones are constantly in a state of renewal. New bones are made when our old bones are broken down. After age 30, most people reach their peak bone mass. As people age, their bone mass is lost a lot faster than it's created. In osteoporosis, there's an imbalance in the activity of osteoblasts that form from new bone and osteoclasts that reabsorb bone. Let's talk about the etiology of this disease. People who have low bone mass are at risk for developing osteoporosis. 80% of osteoporosis cases affect older women. Primary osteoporosis, also called type 1 osteoporosis, is associated with menopause. So estrogen deficiency results in increased calcium reabsorption from the bone. So women who are going through menopause should be monitored frequently for loss of bone mass. Secondary osteoporosis is caused by a disease process or an effect of a drug. So renal hypercalciuria is a common cause of secondary osteoporosis. There are several risk factors for developing osteoporosis. Certain diseases, lifestyle habits, and ethnic backgrounds increase the risk of developing this disease. Some of these risks are modifiable and others are not. So many risk factors depend on how much bone mass is achieved between ages 25 and 35. How much bone mass is lost is also a risk factor. So unmodifiable risk factors are risk factors that cannot be changed. Family history, age, gender, ethnicity, and body frame size are unmodifiable. So if you have a family history of osteoporosis, your risk of developing the disease is increased. If you're older than 65, you're also at an increased risk, and women are most likely to develop this disease. There's an increased risk of developing this disease if you're white or of Asian descent. And men and women who have small body frames tend to be at higher risk for developing this disease because they have less bone mass to draw from as they age. So these are modifiable risk factors. These are risk factors that can be changed. Poor nutrition, such as a diet low in calcium and low in vitamin D, can be changed. A high protein diet can cause acidosis and contribute to osteoporosis. That can be changed. Body weight is also modifiable. A BMI less than 20 can be changed. Patients with anorexia nervosa, this is a low body weight, causes the body to stop producing estrogen, which negatively affects bone density. This can be changed with therapy and collaboration with a registered dietitian. Substance abuse, such as cigarette smoking and excess alcohol intake, can be modified, and a sedentary lifestyle can be modified. Osteoporosis can be prevented with good nutrition and exercise. So we want to eat a healthy, well-balanced diet with plenty of calcium and vitamin D, which is essential for the bones. You also want to do plenty of weight-bearing activities to increase blood flow to the bones. And exercising also helps you maintain a healthy weight. There are several different signs and symptoms of osteoporosis. Loss of high progressive curvature of the spine, low back pain, tooth loss. This is when osteoporosis has started to affect the jawbone. Fractures in the forearm, spine, and hip. Osteoporosis is known as the silent disease. This is because bone loss can occur without symptoms, and the disease may not be apparent until the patient has a radiology study done or if they come to the ED with a fracture. There are several different diagnostic tests that can be done to determine if someone has osteoporosis. A bone density test is highly accurate when it is measuring the spine or the hip, and this photo in the corner shows the results of a bone density scan. The top photo shows the normal bone and the bottom photo shows the osteoporotic bone. Ultrasounds are also highly effective in determining osteoporosis. They transmit sound waves to measure bone density, and they are essentially painless. There are several different laboratory tests that can be done. Alkaline phosphate, this can be elevated following a fracture. Osteocalcin, this measures the osteoclastic activity. Thyroid levels, they can be elevated and this can cause bone loss. Parathyroid levels are also elevated. And estrogen levels in women at menopause, and this is going to be decreased. Physical therapy is very important for patients with osteoporosis. Working with a physical therapist can help you design appropriate exercise plans. Weight-bearing activities such as walking, jogging, running, stair climbing, and skiing are great exercises that help strengthen the bones in your legs, hips, and lower spine. Balance exercises such as Tai Chi and yoga help reduce your risk of falling. And this photo in the corner here shows people doing the Tai Chi. Dietary management is also very important for a patient with osteoporosis. Working with a registered dietitian can help you make healthy diet choices. Vitamin D, such as cod liver oil, trout and salmon, milk, bread, and fortified cereals are very important to include in your diet. And including a multivitamin is also important because this has a great source of vitamin D. Calcium is also important to include in your diet, so milk, cheese, yogurt, beans, and leafy greens have good sources of calcium. Eating a variety of foods with calcium can reduce your risk of developing osteoporosis. Pharmacology therapy is also indicated for patients with osteoporosis. Calcium gluconate or oral calcium supplements are often prescribed. These medications prevent and treat osteoporosis. They work by slowing down the rate of bone loss. These medications can cause hypercalcemia, and symptoms of this include lethargy, drowsiness, weakness, headache, anorexia, nausea, vomiting, increased urination, and thirst. Bisphosphonates is another medication that's often prescribed. This medication works by inhibiting bone reabsorption by suppressing osteoclast activity and increasing bone density. This reduces the risk of fractures. It's important to not take this medication on an empty stomach because the medication is poorly absorbed. Just to recap on some general self-care for osteoporosis, you want to take an active part in your treatment. You have a choice in your treatment options. Exercise for at least 30 minutes daily, 5 days a week to prevent bone loss. Eat a balanced diet that is rich in vitamin D and calcium, and don't smoke or drink alcohol in excess. Here's some more self-care information. You want to reduce your risk of falling because this increases your risk of getting a fracture. Review your current medications with your healthcare provider. Some medications can cause dizziness, so reviewing this with your provider can help prevent falls. Have your eyesight checked at least yearly. Having poor eyesight can increase your risk of falling. Wear non-slip shoes and add a walking assistive device such as a cane if you're feeling unsteady. Remove rugs from your home because they prevent a major tripping hazard. And consult with an occupational therapist. They can assess your home for fall risks.